Now to the coronavirus pandemic. The death toll in the U.S. is nearly 600,000. According to Reuters, the death rate slowed almost 90% since January, but we are still averaging nearly 400 deaths per day. And President Biden says that's, quote, still too many. And health experts are eyeing a new threat as vaccination rates stall across the country and the Biden administration kicks off a vaccination tour. Carter Evans reports from California.
With nearly 600,000 deaths, there's more COVID trouble ahead. The Delta variant is now taking hold in the U.S., 10% of new cases now and doubling every 2 weeks. It's the most contagious variant yet, even infecting those who are partially vaccinated.
It's probably going to become the dominant strain here in the United States. I think the risk is really to the fall that this could spike a new epidemic.
The Delta variant is now responsible for 90% of all new COVID cases in the UK. With this spike, the Prime Minister is now ordering a 1-month delay for reopening. Back in the U.S., the first federal ruling on employer vaccine mandates. A federal judge dismissing a lawsuit against Houston Methodist Hospital by healthcare workers who are refusing to be vaccinated.
This will be taken all the way to the Supreme Court. This is far from over.
But a CBS News poll finds 56% of Americans believe employer vaccine mandates should be allowed. This as vaccination rates stall in much of the country, most notably in southern states. Today, Vice President Harris addressed hesitancy in South Carolina.
The vaccines, they are safe and they are effective.
And a new weapon may be coming by fall. Novavax now reporting its vaccine is 90% effective in clinical trials and could be used as a booster shot. California's vaccination rate already tops 76% as new cases plummeted 98% from the January peak. The state's now lifting all COVID restrictions starting tomorrow.
What is this going to do for business?
Double it. We're going to have capacity to come back out of the red zone that we're in financially and into the black.
Does it feel like it's starting to get back to normal?
It really does.
This many people on the Santa Monica Pier might have sparked super spreader concerns just a few months ago. Now, these big crowds could soon mean big business again. But the tourism economy here is expected to take a full 2 years to recover. Elaine?
Carter Evans, thank you. Dr. Teresa Amato joins me now. She's the Director of Emergency Medicine at Long Island Jewish Forest Hills. Welcome, Dr. Amato. Good to see you again. So there have been nearly 600,000 coronavirus deaths in the U.S. President Biden says that we're averaging 370 deaths per day, and he's urging Americans to get vaccinated. Doctor, what will ultimately determine how much longer this fight lasts for us?
Well, there's so many variables. We're looking at these variants, and we're looking at the rate that people are getting vaccinated. And, we really, ideally, we would have everyone vaccinated by now who would be eligible. Still that hesitancy that we see for people accepting the vaccine. I'm trying to chip away at that, and that's going to be one of the biggest factors. And we can see now the states that have the highest vaccinated level of people are plummeting in their cases. So we do know that these vaccines are really the way out of this pandemic. So we're going to hope that we can start to really hone down individually to see how we can get people to be more accepting of the vaccine and actually take it. The concern I think a lot of us have is this variant is now about 10% of our cases here in the United States. So it's not going anywhere. If anything, it's just going to increase. The scary part of that also is if we look at India and China, the folks who have the Delta variant are actually sicker. They're higher risk of getting ICU admissions and a higher risk of death. So we really don't want this virus to continue to be transmitted. So for folks who are not vaccinated, I would say you're still going to have to take the precautions that we were having, before the vaccines came out. And we can feel pretty reassured if you've had both of your vaccines. There's a good effective immunity with these two vaccines, the two-shot vaccine to the variant. So that's hopeful. So again, there's so many variables. It's going to be I think time is going to have to tell, and we're going to see how this summer goes.
Well, Vice President Harris kicked off a nationwide vaccine tour Monday. She said there are a lot of people who are not sure about getting the vaccine, and she attributed this hesitancy to misinformation or, quote, maybe the lack of correct information. Doctor, remind us, what are the facts about these vaccines?
So what we have found, these vaccines are extremely safe. They're extremely effective. Are there side effects? Of course. We know with the Johnson & Johnson, we saw some folks that had issues with blood clots. We have seen some reactions to some of the other vaccines. But at the end of the day, they're still much safer than actually getting COVID. They are very effective that even if you were to get COVID after you've been vaccinated, the chances of you getting sick, being in the ICU, or dying are dramatically decreased. Again, the science behind these vaccines, although it's a novel vaccine, the use of mRNA for in healthcare is not anything new. It's been being used in cancer and on cancer treatments. So the science is pretty solid. I have seen a few people who've had, sore arms, body aches, little low-grade fever. That's sort of the same symptoms I had. Very treatable with some Tylenol, some Motrin, and some rest and some fluids. So again, the side effects that are usually very minimal far outweigh the risk of actually getting the COVID virus itself.
Well, a new CBS News poll found 84% of U.S. adults who do not want a vaccine or are still undecided say that incentives are unlikely to change their mind. If that's the case, Doctor, what do you think the best way is to reach these people?
Yeah, so I've had some mixed feelings about the incentives. I think it'll get some people to do it, but I think really what you have to do is to understand people's concerns and try to maybe talk a little less and listen a little bit more so that you can understand why there is hesitancy. And there's a variety of reasons why people have hesitation to getting the vaccine. I've actually gotten a few patients to change their mind once I just kind of listened to what their concerns were. A lot of it, again, is some miscommunication, misunderstanding of the data, getting their healthcare background from some online searches and going to websites that I don't know what if they're actually true or not. So I think having really strong heart-to-heart conversations with patients and really acknowledging their concerns, not belittling them or in any way judging, just to say that all feelings are valid. So if they have concerns, I try to answer questions as best I can. I even had one patient who actually called me a few days later and asked me some more questions. And I think eventually that person will end up getting the vaccine. So I think building a trusting relationship with your healthcare provider, your physician, ask all the questions you need to feel comfortable. I think that's really the way people are going to start to feel more comfortable of getting the vaccines. Again, I understand the use of incentives, but I think I kind of didn't think it was going to work that well, and I wasn't surprised that it didn't. But I do think making it more accessible is definitely going to help. Here in New York, they're actually giving it out on public transportation hubs. So people who can't get it because they have to go to work every day now will be able to get the vaccine because it's their subway ride to work.
Right. Well, as you point out, though, given how much misinformation there is out there, it is a huge challenge, Doctor, as you know, trying to reach and connect with people to try and combat some of that misinformation. Dr. Teresa Amato, always good to see you. Thank you so much.
Take care. Thank you.